Hi, my name is ALKRTY. Um, um, Today I will give you a short presentation on global health. So our presentation is going to be about the um, global health, worldwide health issues, and this presentation is divided into six parts. The first part, I will be talking to you about the global guardian of public health. The second part is going to be about historic achievement in global public health work. The third part is going to be about World Health Statistic 2016, monitoring health for the Sustainable Development Goals. And the fourth part is going to be about the United Nations agencies and funds involved in health. The fifth part is going to be about the United Nations observance related to health. And the last one is going to be about resource. So if someone interested in more information about this topic, so I have placed some links there, so you can just go to that resource and gain more information. Just before I start, I want to remind everyone about my previous voice record videos. So my PowerPoint, I've been talking about the global issues, and under the headline of global issues, I've been talking about many topics such as Africa. I've been talking about Africa challenges, and I have outlined the challenge that facing the African nation at the moment. And I did talk about the agents and how the world population are getting older. I did talk about the AIDS, HIV infection, and how the global or the international community has made some achievement in terms of fighting the disease of or the infection of HIV/AIDS. I spoke about the children and the right of children, especially in the armed conflict, and how we should protect children and how we apply the children right according to the international human rights laws. I spoke about the food shortage and hunger and poverty, and how are there many million of people are dying because of short of food, whereas there is many people are obese or overweight. So there is imbalance of the disturbance or distribution of the food. I spoke about the human rights issue, and I said everyone around the world, as human beings, we deserve the human rights. So regardless of the colors, religion, or any other status. Peace and security, and how it's important for the development, because without peace we can do nothing, because we need to have peace first and security. After that we can think about the other thing. So the peace and security should come first. Population, and how the world population are growing fast and fast. And I have mentioned the the significant difference between the years, the 5 years back or 10 years period of time, and the population are increasing. And I said that the India and China, it had the most populated people in the world. So China first, after that India, and they are represented I think between 19 and 18 no 18 and 19 respectively. And I was talking about the water, and how important the clean fresh water and sanitation, and everyone has to access to fresh clean water and a sanitation service. Today, the last topic is today is not last for today is the health. So as I said, or as I mentioned earlier, I will be talking about this part. So the my my topic is my topic, it has been divided into 6 parts. So let's start. The first part is about um, the global guardian of public health. It says here is about figures, about the facts or realities. It says the United Nations, as I said earlier before, or the previous video record, I said the United Nations as the international organization has a legal obligation to step in to address many global issues. Therefore, the United Nations, since it is inception, which means since it's founded or the beginning of the organization, um, has been actively involved in promoting and protecting good health worldwide, everywhere around the world, leading that effort within the United Nations system in the World Health Organization, WHO, which stands for the World Health Organization, whose constitutions come into force, which mean by constitution the law or the convention, force on the 7th of April 1948, a date we now celebrate every year as World Health Day. So the 7th of April of every day, the international community come together to celebrate the date of the World Health Day. At the outset or the beginning, it was decided that the WHO top priority would be malaria. So this is the first initiative, or the priority of the organization was the how to fight the infection called malaria, or the disease called malaria. It's not infection, is and they call it non-communicable disease, or disease doesn't separate between people because of the fluid or saliva or something like that. So the first priority was the to how to fight malaria, women and children health, tuberculosis. Sometimes we call it TB, viral disease, which mean um, I was thinking about this term of disease, which I think is term for sort of disease that doesn't it's something to do with the yes, sexual transmitted disease. This venereal, they call it venereal disease, nutrition and environmental pollution. So this is the priority. What the priority of the World Health Organization to fight malaria, women and children health, tuberculosis, sexual transmitted disease, nutrition, and environmental pollution. So many of those remain on health is still now the priority of the World Health Organization agenda until now today. In addition to such relatively new diseases as HIV/AIDS, diabetes, cancer, and emerging diseases such as SARS, which means severe acute respiratory syndrome. This is hereditary disease. It runs through the family. And there is Ebola in West Africa, and there is Zika virus in South America. We're still about the historic achievement in global public health works. So I'm still giving you some fact about the global public health. So it says here in 1948, World Health Organization took over the responsibility for the international classification of disease, which has become the international standard for defining and reporting disease and health condition since its creation. uh, the World Health Organization has contributed to many historic. Some of them are so the specialized organization at the moment in the world is the World Health Organization. Is it has a huge role in terms of the international health and international classification of disease. So there is fact here about the achievement. Some achievement is great achievement has been done by the international community since 1950 or before or since 1948, since the found of the WHO. So antibiotic, this is the medicine or medication. In 1950, the great era of discovery of present the antibiotics begin, and WHO began advising countries on their responsibility use. Unfortunately, today there is many people are misusing this medication, and as a result, so there is many. So if you overuse this medication, maybe it won't have any effect on fighting the virus on our bodies. This is according to the information that I have gained from the WHO. So let's move on. Uh, polio. Polio is other disease. 1988. The global polio has end initiative 1988 is established at the time when polio paralyzed more than 350,000 people every year. So it has finished right now. It's gone. This sort of disease that can cause paralysis is gone right now. Since then, polio cases have decreased by more than 99%, almost gone. This is a great achievement. It's tremendous because of the immunization against the disease worldwide. So therefore, I think immunization is very important, and as I mentioned earlier, immunization in many countries are compulsory. So parent and family has to immunize their kids against many diseases, and that contribute to of decrease of many diseases such as polio, smallpox, other disease. 1979, following an ambitious mean having a strong wish to be succeed. 1979, following an ambitious 12 years global vaccination campaign led by WHO, smallpox is gone right now. Tuberculosis, 1995, the strategy for reducing the toll of tuberculosis (TB) is launched. At the end of 2013, more than 37 million lives had been saved through TB diagnosis and treatment under this strategy. So there is achievement being made, as I mentioned earlier, which is great. Okay, we're still talking about the historic achievement in global public health. So let's talk about AIDS or HIV/S infection and tuberculosis malaria 2011. The Global Fund to Fight AIDS, Tuberculosis and Malaria, a new partnership of and funding mechanism initially hosted by the excuse me by the WHO, is created in a collaboration with other United Nations agency and major donors. Okay, the second achievement was about children mortality when the child died before before their fifth birthday, and has declined below 10 million for the first time in recent history. Heart disease, diabetes, cancer. In 2012, for the first time, WHO member state get global target to prevent and control heart disease, diabetes, cancer, chronic lung disease, and others non-communicable disease, which means disease that doesn't transfer from person to person because of the blood or any fluid come from our bodies. Ebola virus outbreak 2014, the biggest outbreak of Ebola virus disease ever experienced in the world strikes in West Africa. So the WHO right now has made a achievement by it says that this disease has gone right now. There is no any cases being reported since 2014, and therefore in 2016 the WHO had announced that the Ebola disease in West Africa has gone and there is no any case being reported. But we have to be vigilant, we have to be careful and prepared. We don't want what happened in 2014. Many lives has gone or lost, like 11,000 people have died because of this disease, and these people they shouldn't have died. World Health Organization staff who include medical doctors, public health specialists, scientists, and epidemiologists, that's people expert in certain of disease and intervention, cover all areas of the global health. So this is preparation, and this is the international community has prepared for the if there is anything occur in the future, so the response is going to be fast and is going to be a significant. Okay, let's talk about the World Health statistic 2016 monitoring health for the sustainable development goals. So here we are going to make some contrast between the sustainable development goal and the millennium development goals. So it says here, while the millennium development goals focus on a narrow set of the disease specific health target for 2015, the sustainable development goals look to 2030 and are far broader in scope. For example, the sustainable development goals include World Health Goals, ensures health, life, and prompt well-being for all ages. So as you can see here, the sustainable development goal covers many aspects of health, whereas the millennium development is covered just a specific thing. So we rely on the sustainable development goal at the moment. So the report from the WHO Health Organization has provided comprehensive overview of the latest yearly data in relation to the health-related target in the Sustainable Development Goal, illustrating the scales of the challenge every year. So here it says here the fact or the figures here says 303,000 women died due to the complication of pregnancy and childbirth. 5.9 million children died before their fifth birthday. Shocking. 2 million people are newly infected with the HIV, and there are 9.6 million new TB cases and 2014 million malaria cases. 1.7 billion people need treatment for the neglected tropical diseases, and more than 10 million people die before the age of 70 due to the cardiovascular diseases and cancer. 8,000 8,000 people committed suicide worldwide. 1.25 million people die from road traffic injuries. 4.3 million people died due to the air pollution caused by cooking fuels. 3 million people died due to the outdoors pollution, and 475,000 people are murdered, 80% of them men. People are dying for some reason. Whatever the reason, the death is one, as it says. Okay, the United Nations agencies and funds involved in health. As I said, there is many international organizations specialized on health. And what the text read here, it says it would be misleading to suggest that the entire work of the United Nations health system is supporting of global health result with the WHO. So there is many agencies such as the WH fund, and many health related matters are addressed directly by the General Assembly and the Economic and Social Council, as well as the through the effort of the joint United Nations programs on the HIV/AIDS and UN AIDS. The work of the United Nations population fund is support for a the theme of protective adolescent and mental health, and the health related to activities of the United Nations Children Fund. All these specialized organizations work together as a team to fight diseases and to make the life, the quality of life much better. Okay, the United Nations observance related to health. In addition, there is there is there is like celebration day, as it mentioned here, the World Health Day, 7th of April every year, and there's the World Water Day, 22nd of March, World Autism Awareness, the 2nd of April, and the World Number No Tobacco Day, 31st of March, and the International Day Against Drug Abuse and Illicit Trafficking, 26th of June, World Mental Health Day, 2nd of October, World Diabetes Days, the 14th of November, and World AIDS Day, the 1st of December. So, why the United Nations has observed all these days? Because they try to promoting and protecting the international health. Okay, we come to the end. Right now we are in the last slides about the resources. So as I said earlier in the beginning, that is anyone interested in more information related to the health organization or related to the international health or global health, just go to one of these website and you can get more information about the topic. I would like to thank everyone for listening, and I will see you sometime very soon. Thank you so much. Bye for now.